Our next speaker is Alice Lakati from the mHealth, the African headquarters of mHealth. She's going to be speaking, talking about a mobile intervention for training community health workers to assess the stages of child development. You know, you probably see, you're welcome to sit up here. You're welcome to sit here.
Good afternoon. First of all, I want to thank you for giving us the privilege to present our work as AMREF and our partners. You can see from the slide that it has so many partners. This is a project that AMREF, which is based in Africa, works with the London Knowledge Hub. And this project was funded by DFID. One of our colleagues has recently gone to Oxford University, and this is why you also see the Oxford University logo. And I also want to acknowledge all the colleagues who are here. So basically, when it comes to asking questions, probably I'll not answer all the questions, but my colleagues who are here, Simon, Anne, and Nile, will also be able to answer the question. So at AMREF, we work to develop a mobile intervention for training community health workers to assess the stages of child development. The term community health workers, currently in Kenya, we have defined community health workers as community health volunteers, because community health workers actually are not on a paid system as we had today in Ethiopia. So they are volunteers who work at the lowest level of the health service. And this intervention actually worked to leverage their role in terms of provision of health services. And also in Kenya, the Ministry of Health has recognized the role of community health workers, whereby currently we have a community health strategy that really integrates the role of community health workers into the health system. So the aim of this project was basically to understand the role of using a mobile intervention to really support the work of community health workers in terms of supervision and health service delivery, and in this particular case, basically using it to develop a project in terms of allowing community health workers to identify the milestones of child development. And the project used an approach that used the grounded knowledge of allowing the community health workers to take part in the design and in running the intervention. And if you go through that web link, you'll be able to read more about this project. So this project was done at 2 project sites. Knowing the map, Kenya is somewhere at near the Horn of Africa, just below Ethiopia. And the project was done at 2 sites. At the city, which is Kibera. Kibera probably is one of the largest slums in Nairobi, something we are not proud of, and Makueni, which is a rural setting. So this project allowed us to look at working with community health workers from an urban perspective and from a rural perspective. So Makueni has a population of around 800,000 and is really in the rural area. And it is an area that is characterized by long droughts or spells, while Kibera is an informal settlement. Those of you who have been in Nairobi, you probably have seen Kibera just not far from where AMREF office is. So this project used the participatory action research approaches, which is basically from an epidemiologist we are used to randomized control trial. But in this project, we used a participatory action research whereby we worked with community health workers to a series of meetings, a series of trainings, and eventually this one led to development of an application and development of an identified need at the community health level. So the identified need was the child development stages, whereby the community health workers felt that this is an area that is not adequately addressed in their daily work, because a lot of their work, they're involved in maternal and child health, water and sanitation, but the area of identifying child development need stages was not known. So after working with community health workers to identify this need, we further had meetings and agreements with the subject matter experts. Those are the pediatricians, the nutritionists, at the county level and at national level. And this is where the intervention was designed, that we use this approach aimed at to develop a mobile application that allows the community health workers to identify the child development needs at community level. So this approach leverages the smartphone technology, and it supports the referral system. And the project has been running for the last 12 months. So when you look at the menu of the application that we developed from the community health workers, this is how it looks like. So it allows them to be able to have notes, to have feedback, and the system has been able to allow for support of supervision between the community health workers and the community health extension worker. Looking at the interim evaluation, using this participatory approach, for the last 12 months, we have been able to document a change in practice in the training and quality of supervision of community health workers in both settings, whether in Kibera or in Makueni. The quality of supervision has changed. Also, the monitoring and supervision of community health workers by the community health extension workers, who are basically health workers, has also changed and improved, and now they are more engaged in working together. There is also an increased awareness at household level on the importance of child development monitoring. And there is an increased informed referral system, whereby now we have less delays in terms of referrals, and we have the referrals that are much more accurate. And really of importance to this project is the significant number of disabled, we are calling them hidden children, that have been identified by the community health workers using this system. Because we all know that in many of our settings, disabled children are hidden, so they tend not to get access to immunization, they tend not to get access to hospitals. But using this approach, our community health workers have been able to identify these hidden children. And finally, the key outcomes that we have been able to realize from this pilot project is the intervention has led to an increase in informed referrals. The intervention has also, as seen by the supervisors and as seen by the community health workers, it has been reported as more efficient in terms of the link between the supervisor and the community health workers. And finally, from this intervention, we develop a toolkit that enables community health extension workers to develop a mobile application without the need of really tough technology. So the community health extension workers who supervise community health workers have been able to now, they're developing their own mobile applications which don't require a lot of technology. Thank you very much. I would like also to acknowledge the support from our sponsors and all our colleagues who are here. Thank you.
Thank you.